Without further ado, please give a warm welcome to Daniel Haters.
So first I want to thank Chris, and obviously someone planned this out because I'm literally in the business of daring to suck, right? So I work for two firms, actually both here in town. One, NextCubed, which is an accelerator where we work on accelerating early stage frontier technology companies. I'm also an operating partner for healthcare at Sway Ventures. So literally by definition, we invest in people who dare to suck. We expect maybe most is a bad word, many of our companies to fail. And that's okay, because you can't change the world, you can't disrupt industries, you can't really do anything unless you're willing to fail. So I really want to thank Chris for walking us through that. So, of course, you know, safe harbor, obligatory things, right? This is not advice. This is just my opinion. What I'm going to talk about today is the Internet of Things, and specifically the Internet of medical things. And most interestingly, how the big companies that exist today have it all wrong or have it all backwards. Well, first, I'll take you guys through how we got to where we are today. So in the early 90s, we had person-to-person telephones that existed, and we began to have text messaging, really in the form of pagers, right? Mostly designed to physicians and other professionals. And then as you go out in time, you get into the internet of content. So you start to have email. If any of you were like me and started going to school in the mid-90s, going to college, I had DOS-based email, right, in the mid to late 90s. And then you got into Internet of Services, right, just pre-dot-com bubble, where you started to have things that you could buy over the internet. Then you got into the Internet of People with broadband services and smartphones. And then finally where we are today with the Internet of Things. So devices that are smart, that interact with the cloud, interact with other devices, right? So that's the fundamentals of what I'm going to talk about today. Now, the Internet of Medical Things you can see here. And I put this up as a bit of a straw man to talk about how many people think of the Internet of Medical Things. There are really six groups that are involved here. First, you have the manufacturers of the original manufactured the parts, right, that go into the devices. You also have the connectivity providers, the broadband providers. You have the medical device manufacturers themselves, then the software providers that lay on top of the hardware, and then finally system integrators, and then the end user. I'll tell you that I believe that this wholeheartedly misrepresents what IOMT is, and you'll see that as we go along, but I want you to remember that. So why am I talking about the Internet of Medical Things? Well, it's part of a revolution that's occurring now in healthcare, right? And you see it here based on the numbers. The revolution is occurring where we're looking at just over a few-year period. We're looking at sales and profits going from 13 to 45, right, billion dollars just in North America alone. And then these trends aren't limited to the West. You see things happening in South America, the Middle East, and Africa. And it's because there's this ability to connect small, inexpensive devices to the cloud and do amazing things in healthcare. So this is great, right? And you see it. Even more great news, right, from a study by Research to Guidance. Today, less than half of medical devices are connected to the internet. That looks to go up over 20 points in just a matter of a few years, right? Most medical devices last decades, and in just 5 years, it's going to go up 20 points. Fantastic, right? Why is this happening? Well, you see, healthcare globally is an absolute disaster, right? You see it just in the cost, 7.1 trillion up to 8.7 trillion. You also see it in the number of people that are aging, right? That are becoming 65. The total number of people on this earth who are 65 or older is going to double between today and 2050. But to bring that back into something a little bit more tangible for us today, as baby boomers are turning 65 and they're becoming Medicare recipients, there's 10,000 people a day turning 65. That trend started about 8 years ago and is going to continue for about another 12 years, right? 10,000 people a day. And everybody here that's under 65 is paying for their health care, right? So how are we going to fix it? Well, it's this Internet of Medical Things, right? It's going to fix everything. And you see around the outside, some of the amazing things that putting devices in people's hands that can be part of their healthcare, what can it do? So you can decrease cost, right? Which is fantastic. It's always part of the bottom line. You can improve diagnosis. You can improve disease management because now your doctor can be in your pocket. Your doctor can be everywhere you are. Our care team can be everywhere that you are. Enhanced patient experience, right? The ability for artificial intelligence to interact with you in real time. Or when that's not enough, to have care teams that get involved with you in real time. And then finally, all of these things come together in the middle, right? Which is improved patient outcomes, which is the holy grail. So with this sort of IOMT, the promise here is that for the first time, basically since clean water and vaccinations, you actually have a healthcare technology that can reduce cost and improve outcomes all at the same time. And I'll tell you, for those of you guys who are not in healthcare, new healthcare technologies either do one or the other. They do not do both. It just never happens, no matter what any company, what any professional or executive in that area will tell you. It just doesn't happen. All of this is great, right? It sounds amazing. But big med tech still doesn't get it. Of course, anyone that's in this room is part of the converted, so I'm not talking to you guys. But what they miss is the Internet of Medical Things is not about the things, right? It's not about the devices. The IOMT revolution is about data and analytics, interoperability, patients, providers, and payers. Devices are infrastructure, right? They're not an actual solution in itself. And you see some of the problems in this slide, right? So if I have the thesis that it's the software, it's the data, it's the interaction that is important, well, why up here when you look at how much people are spending and how much is being spent on these technologies, why is it that the systems and software down here, right, only make up roughly a quarter of the money that's being invested into the space and the money that's being spent? It's because people are talking, but they're not actually doing in this space. And that's very, very important, and I'll get to why that's very scary if you're in big medical devices right now. Here, you see more examples of why it isn't working. So if you look at the bottom line here, if you tell me, or if I tell you, I guess I should say, if I tell you that data is the most important part of what's happening in healthcare, and then I tell you that only 30% of big med tech firms are actually incorporating new business models, data as a service business models, there seems to be a problem in what's going on. And that's exactly it. Big med tech right now is talking the talk about what IOMT is going to do, but when it comes to their business models, they're not actually implementing business models that sell data. They still have legacy business models that sell devices. And you see it here too. We just talked about the Internet of Medical Things puts your physician, puts your care team in your pocket, right, at any given moment. This chart shows at the bottom that only 40% of big med tech companies today are incorporating the physicians into the design process to improve their productivity. My wife is a physician, and I will tell you, one of the ways that I evaluate digital healthcare companies in my early due diligence process, I come home and I say, you know, honey, I got this company I'm looking at. They do X, Y, and Z. What do you think? And her typical answer is F. No, I would never use that unless forced to by the government or some hospital administrator that's never provided an hour of care to another human being, right, in a clinical setting. And so I look at that, by the way, as a strategic advantage as an investor, that to have a wife that's there and without a filter that's happy to tell me when something is terrible that I'm looking at. And she's good to do that across the rest of my life as well, by the way. But what is the Internet of Medical Things about, right? What I was mentioning, it's about data and analytics. And what you see, again, at the center of this chart is the patient. And that is the whole point. And then what's important here, if you look, when you see the connected devices here and you see the communications, they're part of this ecosystem. But you notice they have zero value until they're transported through the analytics platform, right? The devices and the connectivity only matter when the data is involved. This is also what the Internet of Medical Things is about. It's about taking all of these devices, and then really the data that they produce, and connecting all of these stakeholders in the life of a patient, right? Your primary care services providers, your secondary care service providers, so your hospital systems, right? The payers that are actually footing the bill for this, the life science companies that are coming up with the next great technology, and then the patient as well. And what you see here with the cloud's important because that's where the data lies, right? And it's the data, again, that's important. There's no devices in the cloud. There's only data in the cloud. What's also important, as mentioned before, interoperability, right? If I have 2 or more chronic care conditions, I may have 2 or more medical devices. If they don't talk to each other, then IOMT doesn't matter. And once again, it's about patients and providers. You see in this feedback loop here, constant feedback loop between providers and patients over and over and over again. What you see on your left is just a number of different data inputs, constantly coming back and forth to iterate over and over and over again to improve patient outcomes and improve the life of physicians. So finally, well, not finally, but what I want to say is data is the currency of healthcare. Devices are not important. In reality, drugs are not important because drugs are only even important when you understand the disease and you understand the patient. So what is important, right? So at NextCube and Sway, we only invest in data analytics-driven healthcare companies because we like to think we're only investing in the future of healthcare, not the past of healthcare. And I'll also point out in a few case studies that I'm going to show you guys, top emerging medtech companies who have devices and by legacy definitions are med device companies, they don't talk about their devices. They only talk about their data. They only talk about their analytics. Let me give you an example here. For full disclosure, these are all companies that I have a relationship with or invested in, but I mean that to say that I know them well. The first one is the company that got me into digital healthcare, Quio. Quio calls themselves a connected therapeutics company. No mention of device, no mention of 5G, right? That's in that name. And what they actually have, what they're selling you, they actually have a device that's for folks that are on self-injecting biologic medications at home. Many of these biologics over the course of the year may cost $100,000, $200,000 just to treat a single disease. This company, Quio, allows those folks who self-inject at home to have adherence monitoring services. So if they don't take their medications or they're not taking them in time, care teams immediately can get involved and make sure that they're not having a problem or they've had any acute incidents. They're a patient engagement company, right? They're a personalized health company. They are a population health company. But nowhere in here do they mention their medical devices, even in their graphics, right? Even in this graphic. No mention of a medical device anywhere in there. In this business, that their foundational patent is around a device. It's because the device isn't important. It's about the data that the device generates. Another example here of some of the ways they describe, but you see in the middle is the cloud, sort of harkening back to the previous slide that I showed. Another company familiar with, a company called Applied VR. This is a company using off-the-shelf off-the-shelf IoT device that they put their software on. That software is used in the pre-op and post-op pain and anxiety management space. And this firm will be going forward into clinical trials and to FDA approval likely in next year. And so what you see again, right, it's a company with a device connected to the internet, but they call themselves a therapeutic virtual reality company, not a medical device company. Then you have a company called BioVirtua. BioVirtua says they're sequencing human movement. What they really do is they take off-the-shelf depth sensing cameras, they put their software on top, they create an augmented reality environment that measures human movement. You wouldn't know it right now, but when a drug company develops a new drug to, say, reduce tremors in a Parkinson's patient, the physical therapist that's on the other side rating if that drug works or not, they're doing it based on a 1 to 7 or 1 to 9 scale that's completely qualitative. BioVirtua switches that paradigm so that they're actually able to quantify human movement down to 1/10 of a degree currently. and then able to take that technology and tell you if that drug is really working. Again, they use a medical device. They're working in healthcare. They're not called a medical device company. They call themselves a virtual biomarker company. And finally, not everything's perfect in this space. Of course, when you have these devices, you need security. But all the best IoT companies that are out there, they're all using services like MedCrypt. MedCrypt, a technology cybersecurity provider specifically designed for this space. Guess what? Big med device companies, they're just getting the news where newer startups have been using this technology for multiple years already. So finally, the barbarians are at the gate, right, when it comes to legacy medical device firms. And the barbarians are pounding at the gates, and they want to overtake these legacy companies. But this is what's even scarier. The tech giants are coming here, right? Your Amazon, your Google, your Microsoft, your Apple. I've compiled just a few headlines just from the last few months to show what's happening now. Amazon is launching a medical device brand focused on diabetes and cardiovascular disease, right? Apple's unveiling their watch with FDA-approved ECG. Google is investing millions and millions and millions of dollars to build AI to reinvent the $3 trillion US healthcare industry. And Microsoft Healthcare is bringing doctors into the current century and taking them to the cloud. So not only do the legacy biotech company or legacy med device companies have the barbarians at the gate, but the tech giants are following right after them, right? So if you take anything from today's talk, I want you to think of data, 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 right? And we just recently had an election, to paraphrase James Carville, the data's stupid, right? And please take away the Internet of Medical Things is not about the things, right? The Internet of Medical Things is about data analytics, interoperability, patients, providers, and payers. At NextCube NetSway, we like to think that we're leading the way here. And in that way, as a San Diego-based firm, we're not just talking about this, but we're actually living the life. And so we're, in fact, doubling down on this area and launching a digital healthcare accelerator to support these companies in mass, because we believe this is the future of healthcare. But it's the future of healthcare when you're in the right mind state, right? It's only the future of healthcare when you're focused on the data. It's not the future of healthcare when you're focused on the things and you're focused on the devices. Thank you.
Awesome. Thank you